Welcome everyone to Georgia State University and the School of Public Health and our recognition of World Environmental Health Day for 2020. World Environmental Health Day is actually tomorrow, the 26th, but we felt it would be best to recognize the event by hearing some of our views here in this brief webinar, and so we appreciate your attendance this morning. I'm going to quickly introduce our panel, and then I will be presenting, we have Dr. Christina Fuller to follow me, and Dr. Priscilla Oliver will go third. Sarah Anderson is going to be a reactor and help us moderate the Q&A at the end. So quickly for introductions, let me first introduce Dr. Priscilla Oliver. Dr. Oliver is a retired life scientist from the U.S. Environmental and Protection Agency here in Atlanta, Georgia. She was a federal employee for 45 years and 7 months and worked in 3 different agencies, the Army Corps of Engineers, the Fish and Wildlife Service, as well as the EPA. She was the regional manager for the Partnership for Sustainable Healthcare program and the president of the American Federation of Government Employees, local at EPA. Dr. Oliver has received the 2014 National Sanitation Foundation Walter F. Snyder Award in Environmental Health, which is one of the highest honors any environmental health professional can ever receive over their lifetime. Dr. Oliver is a proud graduate of the University of Alabama in Tuscaloosa and has a Master of Public Administration and a PhD in Educational Administration from Georgia State University. Go Panthers. She is currently an adjunct professor at the Morehouse School of Medicine in their Master of Public Health program. Notably, Dr. Oliver is the past president of National Environmental Health Association, which is located in Denver, Colorado. And Dr. Oliver served as president of NEHA from July 2019 to July 2020. Okay. Secondly, I'll introduce Dr. Christina Fuller. Dr. Fuller is one of my colleagues in the School of Public Health, Department of Population Health Sciences. Dr. Fuller is an associate professor, and she has degrees from Northwestern University, where she earned her BS, and graduate degrees, a master's degree and a science doctor degree from Harvard University School of Public Health. She's an expert in air pollution exposures, in environmental justice, and community-engaged research. And I know you're going to enjoy hearing about Dr. Fuller's research this morning. And then finally, Sarah Anderson is a health scientist at the CDC's National Center for Environmental Health and has held many roles within the Division of Laboratory Sciences at CDC. And she currently supports the Deputy Director and manages special projects and initiatives within her division. She began her career at CDC in 2006 and she's received her BS in chemistry from the University of Georgia. Ms. Anderson has earned an MPH degree from Georgia State University School of Public Health in 2012. I'm proud to say she was one of my students, and she's currently pursuing her PhD in environmental health at Georgia State. And just briefly, I'm John Steward. I've been a faculty member in the School of Public Health for over 14 years. I joined the faculty after serving for 30 years in the U.S. Public Health Service. My final 20 years with the Public Health Service was at the Centers for Disease Control and Prevention here in Atlanta in multiple programs. My degrees are from Indiana State University, where I have my Bachelor's of Science degree in Environmental Health, and from the University of Michigan, where I earned my MPH degree in Environmental Health. And I'm a career-long member of the National Environmental Health Association and the American Public Health Association. So I'm going to present this first segment about what is known about the extent and causes of global climate change, what can be done about it, and finally challenge you to join the cause of confronting climate change to make ourselves a better world. This is the first picture of the Earth fully illuminated that any of us on Earth ever saw. It was taken from the Apollo space mission that went to the moon and back in 1972, and it really did change the way humanity thought about our common home. It reminds us that we're all connected and that we're all occupying this same little dot in the middle of space. Each of our actions here on Earth impact our planet and therefore impact every other person. So I'll frame my presentation in three parts about the climate change. First of all, I'm going to address, must we change? And then second, can we change? And then thirdly, will we change? But first of all, must we change? The scientific community all around the world has been telling us for quite a while now that yes, we must change. And obviously, Mother Earth is also sending that same message. So from our ground perspective, the sky appears to be vast and limitless expanse. We stand on the ground and look up, see no boundaries. But in reality, the atmosphere is just a thin shell of airborne gases around the planet. And here you see the sun shining over the Earth's horizon through the lower two layers of the atmosphere, the troposphere and the stratosphere. This photo was taken from the International Space Station. So we're putting 152 million tons of man-made pollution into the atmosphere every single day. Some of those pollutants will increase the atmosphere's capacity to trap heat. This is the basic cause of man-made climate change. Carbon dioxide is the key culprit in man-made pollution. Humans have increased the atmospheric concentration of CO2 by 47% since the beginning of the Industrial Revolution. So here's the basic science of global warming. Energy comes from the sun, and it comes to Earth in the form of light. That energy is absorbed by the Earth and warms it. Some of that energy is re-radiated from the Earth in the form of heat. Some of that outgoing heat is then trapped by the atmosphere, and that's a good thing. It's kept our planet at a stable temperature. This makes Earth's temperature not too hot, not too cold, but just about right to have a diverse ecosystem that's allowed humans and millions of other species to flourish. Now, however, we've been changing that balance in the atmosphere by filling it with heat-trapping pollution. The more heat energy that's trapped and the more our planet warms, the hotter that we get, and this is now occurring at an unprecedented rate. You know about this principle. You probably learned about it in your earlier education. Scientists have known this to occur since the 1800s. So there are many sources of human-caused global warming pollution, and you'll see some here: mining and extraction of gas and oil, agricultural practices, and forest burning. But the main source and cause of rising global temperatures that we see today are from the burning of fossil fuels. Those fossil fuels are used by power plants, by cars, trucks, ships, planes, and other sources. So the burning of carbon allows carbon to combine with oxygen and form CO2. Fossil fuels provide more than 80% of the world's energy currently. Fossil fuel use and emissions have gone up dramatically since World War II, as you can see in this slide. The Intergovernmental Panel on Climate Change, a group of about 1,300 experts from around the world, concluded that there's a 95% probability that humans over the past 50 years have caused warming of the Earth. So in the last few years, you can note from the graph, there was a slight leveling off as the world adopted more and more clean energy, until we just recently had another spike that you see right at the end. As a result of the pollution being trapped in the atmosphere, global temperatures have risen dramatically. "19 of the 20 hottest years ever measured with instruments occurred since 2001. The hottest year of all was 2016. This year, we've seen record temperatures in the western US. For example, Phoenix, Arizona recorded its hottest summer ever, with temperatures 110 degrees Fahrenheit or higher occurring on 50 days in a row, which is also a record. On a global basis, more than 90% of all the heat energy trapped in our atmosphere goes into the ocean. This heat makes ocean-based storms like hurricanes, cyclones, typhoons stronger and more destructive. Half of the increase in the global ocean heat content has occurred just in the last 20 years, as you can see depicted in this graph. The extra heat also disrupts the water cycle. The amount of water vapor that evaporates off the oceans increases as oceans warm. That water vapor is carried over the land and often falls in much higher precipitation events. When the land can't absorb all of the rain that falls from these larger storms and downpours, we see floods and mudslides. The built environment of cities and towns often makes flooding worse because of the extent that we've replaced natural soils with paved streets and parking lots. Water simply can't absorb, it runs off and increases the flooding problems. This satellite photo was taken of Hurricane Florence in 2018. Hurricane Florence produced record-breaking rainfall in portions of North and South Carolina when it made landfall. The flooding extended over many miles and devastated the entire region for many weeks. Many homes were lost and were severely damaged. Storms also have a tendency to stall out and meander slowly when they reach land due to the changing weather patterns we're experiencing. And of course, it's not just the US that's experiencing this problem. All over the world, we're seeing these extreme precipitation events. Here you see an example from southern India, where a bridge has been completely inundated during a heavy storm. Sometimes people wonder, how can global warming be blamed for both causing more precipitation and flooding and at the same time causing drought? Well, the extra heat that's trapped by rising levels of greenhouse gases actually leads to both. As climate changes, precipitation patterns change, leaving some places with less rainfall than before and hotter temperatures that can evaporate water from the soil. This changing rainfall pattern can lead to drought and water shortages. Southern Brazil, for example, suffered a devastating drought in 2015 and 2016. And I'm sure that many of you have been following the Western wildfires that have been so much on the news over the last few weeks. These wildfires have resulted in entire towns being burned, mass evacuations from those towns, extremely poor and unhealthy air quality in cities like Los Angeles, San Francisco, Portland, and Seattle. And it's been so massive that this huge smoke plume has traveled all the way across the United States, and it has been visible on the East Coast. Higher temperatures have a direct effect on the number and severity of wildfires. Here you can see the number of large fires, and it corresponds to the years with higher average spring and summer temperatures. And the fire season today lasts 100 days longer than it did in 1970 in the Western US. The number of climate-related extreme weather events has been going up worldwide, according to data that the insurance industry collects. The first 2 years rank among the top 10 most expensive disaster losses ever. This photo is of a glacier in southwest Greenland that was shot in the summer of 1935 and shows glacier ice covering fjord walls and filling up this valley, this glacial valley. In the second photo, it's the same glacier, which has been almost completely melted by 2013, not even a century later due to rising temperatures. So NASA has measured very precisely the decline in the mass of ice in both Greenland and Antarctica. This extra melting of ice is already raising sea levels worldwide. Looking at cities by risk of sea level rise by population, we see that many huge cities in the developing world are very much at danger of sea level rise. If parts of these cities become inhabitable, where will the people go? Climate refugees will suffer disruption and poor health and quality of life. Civil unrest is already occurring because of climate-related forced migration in some parts of the world. Agriculture is also expected to suffer in many areas, and it's predicted that people will be less food secure in places like Central and South America, Africa, and South Asia. Heat stress is now beginning to decrease crop yields from rice, soybeans, and corn, as you see depicted here. Exposure to higher levels of carbon dioxide in the atmosphere also decreases the nutrition content of many staple crops, such as rice, wheat, and soy. So the public health community has recognized that climate change certainly is a health emergency. The Interagency Panel on Climate Change stated that climate change would cause increased heat-related mortality and morbidity, greater frequency of infectious disease epidemics following floods and storms, and substantial health effects following population displacement due to sea level rise and storm activity. This panel estimated that by the year 2030, the world would be experiencing an excess 250,000 deaths per year due to climate change. And many people are speaking out about climate change as an environmental justice issue. Many of the factors causing climate change, like air pollution from fossil fuel burning, are harming the health of poor people in disadvantaged populations, people of color in the US and worldwide. Poor and marginalized populations are often impacted by climate events like extreme storms, droughts, and flooding. Addressing the problems like air pollution, improving transit, and making better land use decisions can promote more environmental justice at the same time as addressing climate change. Warmer temperatures have an impact on the spread of tropical diseases. Modern transportation, like air travel and shipping, do play a part, but the potential range for many diseases expands as regions farther and farther from the poles get warmer. This means there are more and more places where diseases, especially vector-borne diseases, can take root. The Aedes aegypti mosquito that spreads Zika, dengue, and yellow fevers is now found in a wider range in a warmer, wetter world. In warm temperatures, mosquitoes breed more and are able to transmit the disease for longer periods of time. The health impacts of the climate crisis are often overlooked, but they will certainly affect millions of people. Exposure to extreme heat itself is a problem in many parts of the world and in the US. Heat can cause medical emergencies like the one you see shown here. Heat emergency events can happen in places that are far from being the hottest places on Earth. Heat emergency episodes have resulted in hundreds of deaths of city residents in places like Chicago and Paris, France, as two examples. The person that you see in the photo succumbed to heat exhaustion in downtown Boston, Massachusetts in the summertime. For these reasons, cities in temperate areas now have to have heat emergency plans to protect the elderly and medically fragile parts of their populations. Okay, so let's go on and look at the second question. Can we change? Well, the answer is yes, and it's very positive and some exciting results that I'll now share with you. Let's begin by considering renewable energy. Wind energy was predicted to provide 3,000 megawatts of electricity worldwide by 2010. As of 2019, we're producing over 6,000 megawatts of electricity from wind energy. The growth in wind energy is being built around the world and is rapidly growing. Wind energy could supply 40 times more electricity than the entire world currently uses. In the US, wind energy output has more than doubled in the last 10 years, greatly exceeding the goals set for wind production. An example is a massive wind farm being developed only about 40 miles north of a place where I grew up in Indiana. And it's placed on top of some of the richest, most productive agricultural land anywhere in the world. And this demonstrates that clean energy production and agriculture can certainly coexist. Every hour, the Earth gets enough energy from the sun to run the entire global economy for 1 year. Just tremendous potential. If we can increase just a fraction of the energy that we harvest and use from the sun, we can make a lot of progress towards solving the climate crisis and help local economies at the same time. Even more dramatic than the wind, we see an exponential growth in the amount of solar energy installed around the world. Solar energy use has more than doubled from 2015 to 2018. And in many countries, there was never any universal electricity grid. And so we're seeing consumers leapfrog the old technology that polluted the air, warmed the atmosphere, and install solar panels in places that for too long have been denied the opportunity to use electricity. This panel is located in a village in South Sudan. So as we've seen, there's strong evidence that we have the ability to change from polluting fossil fuels to more renewable energy sources. So what about that final question? Will we change? So here, there's some exciting news also. In December 2015, the nations of the world convened at the Paris climate negotiations. Every nation in the world agreed to phase down greenhouse gas pollution to net zero emissions of carbon as early as possible in the second half of this century. So climate action isn't just about what countries do, it's also about what corporations, states, and universities commit to reduce pollution and emissions. Cities like Atlanta have committed to action to reverse climate warming by instituting climate action plans. BP, one of the largest energy producing companies in the world, just announced that they would no longer explore for new oil and gas deposits and were beginning a major conversion to non-fossil fuel products. Climate and the need to change our role in global warming has become a top social issue for millions. We're seeing marches and demonstrations and demands at the ballot box that change is necessary to solve this crisis. More and more, people are informed and willing to speak up and to act to support climate change. Note here the enormous numbers of people that came out to participate in the climate march in Washington, D.C. in 2017. So please join those who are speaking out, voting, and making everyday choices to fight the climate crisis. Here are some actions you can do you can be an informed voter this fall and in every election. You can speak up. This is a critical time to be an informed citizen and to let your officials know what your position is on the importance of addressing climate change. Make smart choices yourself in the marketplace and in your own life about energy use, transportation, and where you live. Get involved in professional and community organizations that are working to address climate change. I'm going to add some information in the chat after my presentation that will give you some links to resources so you can be better informed about what you can do and what the options are for supporting climate change. So speak truth to power like the world depends on it. Because your world does depend on it. People's health depends on it. So the best time to commit to climate change was actually yesterday. And the second best time is today. So regardless of whether you're a student, professional, or any other concerned citizen, you can become the change that's necessary to act on this greatest challenge of our planet's climate that's occurred in millions of years. So thank you very much for your attention to my presentation. And we will take questions at the end. And I will now move on to my colleague, Dr. Christina Fuller. Thank you very much.
That was a wonderful presentation, John. And I liked how you ended your last slide, had trees on it, because that's what I'm going to be talking about. I'm going to talk about green and living infrastructure to reduce air pollution and improve health. So this is one area of my research. I do broadly air pollution research, seeing how it varies over space and time, and how some people are disproportionately impacted by air pollution and the resulting health effects. And thinking about trees and utilizing trees for air pollution reduction is an intervention, which will be talking about during this talk. So I invite you to think about the three things that we need to have for our survival. So we need to have water, we need to have air, and we need to have food. So out of these three, I invite you to think about which one do you think we use the most of every day? Well, here's an answer right here. So food and water are very important, but when you think about how much we actually use every day, we actually use the most air. Approximately 50 pounds per day is what we breathe in and out. And we can only go without air for 5 minutes. So its quality is very, very important. And it affects everyone. Everyone's got to breathe, right? So air pollution causes a significant burden across the whole globe. And what's pictured here shows the number of deaths attributable to outdoor air pollution. And the darker colors are those countries that have the greatest deaths, and the lighter colors are the least amount of deaths. So what you can see here is that low and middle income countries have the greatest burden of air pollution mortality. And this is also true of lower income communities as well within countries. The pollution that I regularly investigate in my research is that which is in the urban environments. And a lot of the pollution is from traffic or traffic-related air pollutants or TRAP. So there's several chemicals that come out from the tailpipe based on combustion of fossil fuels. And some of them come directly out. Those are called primary air pollutants like carbon monoxide, volatile organic chemicals, and particulate matter. And then there are also secondary pollutants such as ozone, which is created in the air from those primary pollutants. So particulate matter is the cause of a significant amount of mortality and morbidity related to air pollution. And particulate matter is discussed based on its size. They are either solid or liquid droplets suspended in air. And this figure shows the size of these particles. So what you can see here, that if you were to blow up beach sand, it would be about this size. And this strand of hair would look like this. So the type of particles that we study are those that can fall into different ranges. So coarse, so that's less than 10 microns in diameter. Fine, which is less than 2.5 microns in diameter, or PM2.5. And then ultrafine particles, which are smaller than 0.1 microns in diameter. And when you look at the size, this is a PM10 molecule. Superimposed on that is a PM2.5 molecule. And then superimposed on that is an ultrafine particles. So these are very, very small particles. Even very large concentrations are impossible to see. So trees can potentially reduce particulate matter levels. And this figure shows how that has been estimated in the past. So the darker areas show those that pollution has been removed to a higher degree, and then the lighter areas, those that have been removed to a lesser degree. So this is a combination of the amount of trees that are in these specific areas. These are counties, and it also depends on the concentrations. So if you have a high concentration of pollution and also a high number of trees, the trees will remove a greater proportion of air pollution. And this has been shown on these area-wide scales, looking at zip codes, looking at counties for large swaths of areas. But sometimes we are also concerned about pollution that are close to roadways. So if you look at an area, you can have overall a moderate level of air pollution. But next to particular sources, and pictured here is the downtown connector, you have high pollution coming from the tailpipe of all those cars and trucks. So can trees also do something to remove that pollution? And there is evidence of that. So this shows the pollution that are near roads and how some vary more than others. So if you look at a regional pollutant like PM 2.5, and that's one that is regulated by the EPA, there's not much of a change here. When you are looking at the middle of a roadway, 0 here, and then upwind up to 300 meters, that's about 3 blocks, or downwind about 3 blocks. So you can see not much of a change. But for some of these other pollutants, such as black carbon, which are solid particulate matter, carbon monoxide, which is a gas that we're all familiar with, and ultrafine particles, you will see that you have a spike in concentrations close to the road, and then downwind, it decreases back to about the same levels at about 3 blocks. So it's possible for pollution to be reduced by trees as well, but trees need to be in a different kind of arrangement to have real potential to reduce pollution. So these are some pictures from a research project that I did a few years ago at a local school, where we looked at pollution coming from 85, Interstate 85, and then looking downwind here on the property to see if pollution was reduced. And we did find that the areas which had the thickest tree covers did reduce concentrations by about 50%, which is very important because this is a school which has children go to school there, and they even had an outdoor classroom there. So being outdoors is something that we encourage as much as possible for our children, but we want them to be learning outside in a good environment. So in this case, the trees did reduce the pollution from the roadways, helping to protect these children from higher concentrations. So based on the information that we know, there are a certain way that these barriers can be constructed to have the most benefit. And so what proves to be ineffective are trees that have a high canopy, but you can see the trunks at the bottom. So that means the pollution can go right through. Also, if the trees are sparse, that's not going to reduce the transported pollution from them, through them. So what is efficient are good because they have a large surface area for the pollution. Barriers on concentrations. The United States Environmental Protection Agency does have recommendations for constructing roadside vegetative barriers in a way that would improve near roadway air quality. And just similarly to what John said at the end of his talk, is that it's important to think about how you can take action. And this is related to trees. How can we increase the tree coverage that our cities have? So you can plant a tree on your property that will help to improve overall absorption of pollution from that tree as it grows and matures. You can also support or propose policies in the city to add and maintain trees, especially near busy roads. You can also donate to local groups that advocate for clean environments. And you can also comment on the rollback of clean air regulations as well. And there's multiple ways to do that. So as a point of action, think about one thing that you can do after the end of our talks and in celebration of World Environmental Health Day. What's the one thing that you can do to improve air quality or improve the environment in general where you live? Thank you so much. And I'm happy to answer your questions towards the end of the session. Thanks.
Dr. Oliver is the immediate past president of the National Environmental Health Association, having served as president during the years 2019 and through July 2020. So Dr. Oliver, we're glad to have you here this morning to share your insights with us.
Well, first of all, I must say that I am so excited about being at home. That's with Georgia State University, my rock. I must give thanks to John Steward, Captain retired John Steward. We all knew him from CDC, and we were happy when he joined GSU. I would like to thank you for your continuing support of NEHA and our officers and members. So thank you, John, for all the work you've done with NEHA. I would also like to thank Renee Bazemore, who's your Alumni Affairs Director at Georgia State, because Renee has kept me in touch with Georgia State. She inspired me to become a lifetime alumnus, which I am proud of now. So I would thank you, Renee Bazemore, for all the work you've done at Georgia State and all the work you are doing with me and other alumni. And since I have a platform, I'm also going to thank our president, Dr. Mark Becker. You have made us so proud, and we are so happy with Georgia State as it is today, growing, thriving, and allowing us to have platforms like this to reach the world. So Georgia State, I wish the best for you, and I will continue to work with you. Now, my topic today is on the opportunities and the status within environmental health. As the past president of NEHA, and now I'm called the immediate past president, I feel that I've gone the gamut with environmental health. I started out in the field, and I went on to do administration, which is what I'm ending up in right now. There are so many opportunities, and our status has changed so much over the years until there's not enough time for me to talk, but I'm going to try to cram it into 11 slides and the few remaining minutes that I have. I'm very touched that today we are at Georgia State honoring World Environmental Health Day. Tomorrow, like John said, is the official day. So I want you to get off this call and make some plans to do, as Dr. Fuller and John Stewart have said, do something very special tomorrow. Now, World Health Day started in, World Environmental Health Day started in 2011. And it started with the International Federation of Environmental Health. I want to encourage you all to look for that organization. They're online. They started in 1986. They're located in London, England. One of the things that they do, well, two of the things they do is they disseminate knowledge about environmental health, and they also promote cooperation among environmental agencies throughout the world. Their membership is immense. They have so many countries that are involved. So the first World Environmental Health Day event was started and celebrated, which is our inaugural event, at a summit in Denpasar, Bali, Indonesia. And the good thing about it was that it started with some youth, which is very inspiring. The youth have always been at the helm of starting movement. So the first theme was World Environmental Health Day in 2011. Each year we have a theme. So as we move through the spectrum, in 2012 it was Building for the Future. In 2013 it was Emerging Environmental Health Risks and Challenges for the Future. In 2014 it was Addressing the Environmental Health Inequalities. And in 2015, Children Are Our Future. Let's protect their environment and health. Now, 2016, tobacco controlled a response to the global tobacco pandemic. 2017, indoor and outdoor air quality. 2018, global food safety and sustainability. 2019, beat air pollution. And I'm sorry. And let me go to the next slide here. 2018 was global food safety and sustainability. 2019, the beat air pollution. And 2020, an environmental health, a key public health intervention in disease prevention. And that was about the pandemic. So now, NEHA, the National Environmental Health Association, has joined in with IFEH, the International Federation of Environmental Health, to celebrate Environmental Health Day. One of our concerns globally is tobacco. We know that there's firsthand smoke, secondhand smoke, and thirdhand smoke. Air pollution really affects all in the environment. Okay, now we cannot have a talk about environmental health around the world without talking about the pandemic. The pandemic has put us all in a standstill. Our lives have changed. So now, what is it that we need to do? What are some of the issues and what are some of the opportunities now? First of all, individually, we all need to be safe. Our organizations also need to be safe. That means not only our homes, but our churches, our schools, our restaurants, our educational institutions, whatever they may be, childcare, our healthcare facilities, our nursing homes, everywhere, all need to be safe. So that has been one of the big challenges in environmental health. Our people are working more. We have more hours that we're spending working day and night to keep everything safe. We also need to be healthy. We need to get tested. If you're having signs and symptoms, you need to quarantine, shelter in place, and get to a healthcare facility to get the proper treatment and help. So one of the things that we can do while we're in this state while we're at home sheltering in is we can concentrate on expanding our abilities. Within NEHA, when the pandemic hit, we decided to offer online free classes because a lot of people were upset and hurt that they could not go to conferences and maintain their accreditation and their certifications. So some 66,000 classes were attended by people in the field online, and that helped out a lot. And we want to thank NEHA, the leadership, for being able to offer this to our healthcare professionals, students, administrators, faculty. Now, we also still have those classes, so if anybody's interested, please go to the NEHA website. Individually, I have asked students to now concentrate on themselves. It's a good time to study while you're in shelter. It's a good time to be on the dean's list. It's a good time to pass those tests that you might not have passed. Get your certifications, get your credentials in order, to get your application in order. Perhaps you want to go to dental school, law school when you graduate, or perhaps you just want to change careers. So it's a good time to shelter in, to focus on yourself and expand your career, your horizons. And also for faculty too. If it's a good time to write an article, it's a good time to do some additional research. We're gonna need much research around COVID-19 in all areas, in all walks of life. Now, the job opportunities are there. New jobs have emerged. Some people are in contract tracing now. So look for the opportunities that have expanded since we have COVID-19. Unfortunately, many of our conferences were canceled. And here's an example of one. The International Federation of Environmental Health had a conference planned for Malaysia, so that has been canceled. Unfortunately, it's the best option because it's too dangerous for us to get together. And we know if we hold a conference, some of our people are so dedicated that they will probably show up. Some of them vulnerable, and we do not want that to happen. But I encourage you to go to the website for the International Federation of Environmental Health, check out their activities, get involved. They do take membership, and so you can join the organization. Now, the National Environmental Health Association also had to cancel our conference. It was in New York City this year. And oh boy, had I dreamed and thought of how wonderful it was going to be for NEHA to be in New York, the concrete jungle, and in Times Square. But unfortunately, we had to cancel our conference. It was a good decision because many conferences were canceled. Now we're hoping that next year we will have our conference, and it's going to be in Spokane, Washington. I'd like for you to put that on your calendar. July 10th through the 15th, we're going to have workshops, and we're also going to have the full conference. This will give you a chance to get together with people you know or want to get to know, and also to gain knowledge in areas that you may need in order to fulfill your career obligations. So I want you to join NEHA too. I forgot to tell you that. Membership is open, and for students, we have a low fee of $25. And for young professionals, that fee continues, I think, with $25. So membership is a good thing because you get the Journal of Environmental Health, which allows you to connect with various states and other experts in the field. one thing I'm very proud of when I was president was I appointed 75 expert technical advisors in different fields of environmental health. So if you're interested in a certain area, the information to contact those persons is in the journal. My membership in NEHA will always be, I am now a lifetime member of NEHA. Now, the Georgia Environmental Health Association is another organization where you can get involved. GHA is what they're called, started in 1946. And one thing I'd like to say for students and faculty is that they offer scholarships for budding and interested students that want to enter the field of environmental health. So I direct you to their website. Please get involved locally with the Georgia Environmental Health Association. Now, their conference at Lake Lanier was also canceled this year. So we're hoping that next year we can have this conference. I am a member of the Georgia Environmental Health Association. These are some of the references and resources that will help you get to these sites and learn more and more about World Environmental Health Day, and also the activities in the environment. If you're looking for a job, those are also great sources where you can look for positions. They're advertised on the websites. NEHA has a career section in the website and also in the journal. And students, you can look for jobs in environmental health in the normal websites, Indeed, LinkedIn, so forth and so on. So don't forget that environmental health is everywhere. I thank you for participating in this event. I look forward to seeing you all in person and hearing from you. I have my contact information here. Please feel free to contact me. Environmental health is working right now as we speak, and we will continue to work in the future. Thank you very much.
Thank you, Dr. Oliver. That was very inspirational and informative. We appreciate you participating in our program today and to sharing your expertise and knowledge. So now I will turn it over to Sarah Anderson. As I mentioned earlier, Ms. Anderson is currently a student in Georgia State's doctoral program pursuing public health with a concentration in environmental health, and a member and employee of the Centers for Disease Control and Prevention and the National Center for Environmental Health. So Sarah, I will turn it over to you to give us some insight about environmental health and this morning's program and to lead the Q&A.
Thank you so much. So good morning, everyone. And thanks for joining us today. And I want to say thank you also to all the panelists today for those great presentations. I think it's really clear that climate change and air pollution and environmental health are really great concerns of the 21st century. And it's important for us and also the next generation to kind of understand the impact of these public health issues, not only on human health, but on environmental health as well. So one of the common threads that I took away from the presentations was this idea that the environmental health issues can disproportionately impact certain vulnerable people or communities. And as Mr. Steward discussed in his presentation, the focus of global environmental change is often on temperatures and global warming, but there's clearly so much more going on with, like, when one factor such as temperature changes, everything else is affected too. So it's really important that we look at all aspects of the Earth system and see how and who are affected by climate change. And as we explore those issues surrounding global environmental change and the implications that we'll face if we continue the way that we are, if we continue down this path, I think it's critical that we understand the difference between fact and fiction. the difference between what is known and what is speculated. Because I'm sure, as everyone is well aware, over the past several years, climate change has become a highly politicized issue. It's become a highly scrutinized issue. And I think sometimes the facts get lost along the way. So in the absence, I think, of a clear truth, people can go one of several ways. They will maybe leap to the worst case scenario. They might shrug it off as a non-issue, or they might search for the truth. And until the message of climate change is consistently focused on facts and the leaders can recognize those facts as truths, I think it's going to continue to be a challenge for us to be able to implement meaningful public health policy in that arena. And Mr. Steward discussed several opportunities for a path forward, and I think we have a lot of hope for that. Increasing the use of wind and solar energy and the Paris Climate Agreement, I think, are all great places to start. Clearly, stopping the proliferation of climate change could also be a step forward to address the disproportionate impact that it has on communities of color and low-income communities in the United States as well as around the world. And I'm not going to dive too deep into environmental justice issues because I think they're really complex and they manifest in different ways for different communities. And Dr. Fuller touched on some injustices that are clearly a pattern and that have occurred in the US for several decades. One example being the pollution from roadways, which exposes nearby communities to particulate matter. And injustices can take many forms, including proximity to waste facilities, food insecurity, and all the various health risks that are associated with that. So after listening to Dr. Fuller's presentation, I think we really need to conceptualize how some of these issues, such as air pollution, affects and requires effort from each and every one of us in order to drive meaningful change. And I think as we move forward, we need to consistently ask ourselves, who are the people and who are the communities that are currently suffering from a lack of clean, non-toxic environmental conditions today? And what positions do I occupy and what resources do I have available to me in order to help change that? And I think this is how we can prioritize the needs of those experiencing the effects of climate change, for example, in air pollution right now, instead of portraying the concerns through the lens that these threats are only going to affect generations in the future, which is clearly not the case. So I think not only are we responsible for taking on these challenges, we really need to call on current students and new graduates and emerging leaders to continue to advocate for underserved communities and ensure that the policies of the future not only learn from the past, but also find a way to provide equitable and meaningful progress across environmental health topics. So I want to thank Dr. Oliver for her presentation and for providing some ways to leverage resources and ideas through the National Environmental Health Association, the Georgia Environmental Health Association, and others, especially as we navigate the COVID-19 pandemic. The outbreak, I think, has changed the way we as individuals and as a society really think about our daily habits. It's encouraged us, I think, to consider the fragility of life and the effects on the healthcare system and the role that environmental health can play in infection and disease severity during a pandemic. So I think while the pandemic continues to be a major focus for everyone right now, there are persistent environmental threats that are going to remain beyond that. And I think the current health crises call attention to longer term issues that may raise the risk of infectious disease emergence or reemergence and future pandemics. So I think as we celebrate World Environmental Health Day tomorrow officially, my hope is that we can kind of use our current circumstances to better understand how these threats not only interact with each other, but how we can recover from the pandemic and enhance global environmental health in the future. So recognizing the time that we have left, I'd like to ask some questions to the panelists, and we can also open the floor to the participants on the call to ask questions as well. So feel free, I think John wrote that as well, feel free to pop them in the chat box, or we can also unmute maybe if you have a question to ask. So I'll go ahead and start. I have a couple questions. So this is a question for all the panelists. From your perspectives, how do you think the field of public environmental health has changed in the past 5 years, and what changes do you predict that we will see in the next 5 to 10 years? So I don't know if you just want to start with someone and then work the way down, or however you guys want to handle that.
Well,
Oh,
I will defer to Dr. Fuller.
Thanks, Jen. So I think that in the past, it's been maybe even a little bit longer. I hope you guys can see me. Can you still see me now? I think I was frozen for a second. So I think there has been more interest in cumulative exposures in the past 5 or more years. Because in the past, environmental health scientists specifically were looking at one exposure at a time. But now we have realized that it's not just one exposure over time, it's multiple exposures at the same time, and then they're also cumulative over time and then over the life course. So I think there's been a lot of efforts made in assessing that have occurred over and multiple chemicals at a time, and figuring out how we can really use statistics to estimate those cumulative exposures. And I think that's going to improve in the coming years, because it's definitely something that can really improve our models and our understanding of how multiple chemicals and even social factors and social stressors work together to have effects on public health.
Well, I will go in a different direction in answering Sarah's question. And I'm going to just be very frank with all of you. When I started in environmental health 45 years ago, it was a white male dominated profession. In my first internship, it was all white males. In my second internship, it was all white males except for one female scientist and one African-American scientist. In my third internship, it was all white males that I worked with as colleagues. And I went to the Indian Health Service, and that was a different experience. But I worked directly under the first Navajo professional that had been appointed as a federal employee. When I went to CDC, I worked for the first African-American supervisor in a professional role. So since that time, fortunately, we've had a tremendous transformation in the workforce, and females are as common in the environmental profession now as males, and African Americans and other minorities are significantly, although maybe not adequately, represented in the field. So that's certainly one huge change that I would note.
And along those lines, I'm thinking in that similar direction. There are more jobs now in environmental health than there were 5 years ago. I've noticed that. I've watched the growth when I was at the Environmental Protection Agency. We got up to about 1,500 employees just in Atlanta. Of course, that's dwindled down some now, but the number of jobs, we've gotten more cities now. You know, cities have broken off from big cities and created an environmental health division or a person in those different cities. So it's expanded, and also the reach of the environmental health person has expanded. We do more things with more people and in more ways. The research, the knowledge that we have gained has caused us to now look more at what we need to do. We've got more disasters. Every time there's a disaster, people have to run and help and get involved. We've got more nonprofits involved in environmental health, supplying all the needs of people who are in disaster situations, hurricanes, tornadoes, flooding, even mishaps that happen in the environment. So the expansion of the workforce has been diverse, and it's also been more and more jobs. And I see that in the future is going to be even more, because COVID-19 definitely has given us some more things that we need to address.
Thank you. So kind of in that same line of thinking, what effect do you think COVID-19 has had on environmental health? And what lessons we learned that will change how we face environmental health challenges in the future? I don't know, Dr. Oliver, if you want to start, since you were just talking about that.
Okay, thank you. Yes, I have noticed that there has been a lot of different changes. One thing I'm gonna tell you, and I want y'all to laugh with this one. While I was at EPA, I was president of the union. I represented the scientists, engineers, attorneys, and accountants, the professionals. And there was a move to working at home. Everybody wanted to telework. Well, management fought us. They didn't believe people would work. You got to stand over them, watch them, and be always cajoling people to get them to work. Well, we know that that's not true, but that was their mindset. So we fought. In fact, I didn't leave EPA until I got MaxiFlex, which is you can work different hours of the day. You can work on the weekends. You know, you can expand your work time, not to be just within a set 9 to 5. So we got that through. So we left EPA. I've retired March of 2019. March 2020, guess what? And today, everybody is teleworking. We got them ready. Paperwork was there when the pandemic hit. All people had to do was pick up their computer and get their little, well, I don't even know if they have to have a token now, and go home. And so we've been working at home since March. The federal buildings are closed. Nobody's there. And that's just showing you how things have changed. People are more willing now to look at a varied work schedule and working in different locations. So I'm happy about that. Another thing that has changed is that businesses, schools, hospitals, churches, politicians, the transportation industry, public and private gatherings have all become a topic in public environmental health. We had to address all of that in COVID-19, and we're still addressing it. I'm on a committee for my church, and we still have not decided when we're going to open the church. So many churches are still closed. And my church is Ebenezer Baptist Church in Atlanta, one of the largest churches here. So things have changed regionally, individually. We don't do the same things we did before. We now have to think about our risks, both individually and public, and not just in one location. This is an international problem that has blossomed. So no longer do we just think about what's going on in our neighborhood and in our home, but we have to think about what's going on in other countries.
I will just add one thing about the environmental health workforce with regard to COVID-19 and the current situation. Environmental health professionals have long been recognized as the handiest people to have around in the event of an emergency. And because of the way that environmental health personnel are trained and their orientation toward problem solving and system thinking and addressing problems and enacting real solutions, The Georgia Department of Public Health, just like health departments all over the world, have brought in environmental health people into these key roles to address the pandemic, and are continuing to play roles that we wouldn't consider traditional environmental health. But because of their orientation, they're able to step in quickly in an emergency and be effective personnel. And so this happens time and time again, whether it's the pandemic or a natural disaster or some other event like bioterrorism. Environmental health personnel play an extremely important role in carrying out those responses.
Thanks. I do have a follow-up that I got as a question privately. What pieces of advice can we give to students about finding opportunities because of COVID? So they need experience, but the situation is difficult for them to get that experience. And I would just piggyback a little bit on that and see if there's any specific qualities or skills that you feel are really important for new graduates to have if they want to pursue a career in environmental health, and how they would do that in the current climate.
Dr. Fuller, do you have any ideas about that?
Yes, so the field of environmental health is very wide. So I think it takes a lot of, reflection and talking to people who are in the field to kind of figure out where you would want to be so you can hone those skills. There's still the same amount for to have assistance from students, and they're definitely still learning and internship opportunities. A lot of them have gone online, just like other things have gone online. But there are still opportunities to work out in the field as well. You just have to take specific COVID, protocols. So, so I think, just look at those. If you're interested in nonprofit work, look at the nonprofits and see, they'll post opportunities, and also look with government agencies as well. A lot just pivoted to being online, just like Dr. Oliver was saying. And if you're interested in academics, contacting professors about helping with projects as well. They're still there. They just may have translated to being, online.
And I'd like to add, you've got to think virtual now. First of all, if you don't have a computer at home, you got to get one. You got to learn how to use it. You got to learn how to do Zoom, Instagram, Twitter. You got to learn everything, because jobs are discussed and new opportunities are discussed on those platforms. This past year, this summer, we have had a clinical shadowing program for pre-med, pre-dental students. And when COVID hit, I said, oh my God, what am I going to do? My program's going to crumble. I got to talking, and I found that Kaplan offered iHuman, which is clinical shadowing simulated patients on the computer. So here I am. I didn't know how to use the direct Zoom, but I had to get in there, learn Zoom, and also learn iHuman. And I had to recruit doctors, because you can't do clinical shadowing without MDs and dentists. So that's exactly what I did. We have to be creative. We have to be innovative. You don't accept no. You say, what else can I do? Think outside the box. Where can I find a job? I understand from some students that some professors are letting them work on research projects remotely. So you can do some virtual work at home. Just think about it. All federal workers are now pretty much teleworking every day, or they're doing 2 or 3 days out of the week where they're at home. So work has not stopped. We can't stop work. We can't stop school. You can get graduate programs. I've got some students who are pursuing master's degrees. while they have this time of no work. So you got to think outside the box, look online, the jobs are there. We also have virtual inspections now of restaurants and facilities. That's a part of our profession that's ongoing. So don't think just because there's a pandemic that the world is not moving. Jobs are moving. People are doing what they have to do. We're just doing it differently. So please, and don't be afraid to start your own business too. There are some opportunities that maybe you notice that nobody else is doing. The pre-med program I started, that's my creation. Paul's Partnerships, helping students get into medical school with clinical shadowing. Now we've gone virtual. We also offer MCAT prep and DAT prep, LSAT prep, and GRE. It's a good time to take a look at where you want to go. Maybe you're in one position now, but 5-10 years from now, I want to be a doctor, I want to be a lawyer, or I want to be a professor. That means going back to school. And this is a good time to get in, to go back to school.
Yeah, I was just going to add just a couple of thoughts quickly to complement what Dr. Fuller and Dr. Oliver said. I really encourage you to cast a wide net with your searching. Don't be constrained by titles of positions or the announcement title that you see. Think about, number one, is this something that I could do? Look at the duties and responsibilities. Is this something that I could do and do I have the skills to do that job? Would this benefit my career by having this job? And thirdly, how would I contribute? What would this contribute to my overall career direction? And then how can I convince someone that I can do this job and it's a job that they should consider me for? So don't look for the ideal job. Look for positions that can be fulfilling and rewarding and can benefit your career, even if it's not what you see as your ultimate, career goal.
Thanks. It looks like we have maybe just a couple more minutes. So, and I do want to echo what everyone said. I think from my perspective, CDC is still hiring as well. We're all remote and there's still opportunities out there. It's, just finding what's a good fit. So maybe one final question, and maybe if everyone can answer this in 30 seconds or less or something. Based on your experiences, what do you feel are the most critical changes that we must make to face future environmental health challenges effectively, both individually and as a society?
I'll just add, I've said it, I think innovation and creativity. That's what we need in the field of environmental health. We also need your membership in the various organizations that support the environment.
I agree with that. And I also think that we cannot be complacent as practitioners or students or researchers, that we have to be vigilant that the laws that we have are still being upheld and not being rolled back. So that means that we need to really understand what's going on with the laws, and we have to get, we have to get active as advocates for our laws and making sure that they are supported and that they stay around, because things can change significantly. So be active and be an advocate.
Change is the one constant. And Dr. Oliver and I have been in the field long enough to know that things go through cycles and they ebb and flow in terms of the value given to various programs in public health. And the jobs in environmental health have seen this rise and fall over the decades. So You may feel like this is a kind of a low time in terms of how public health is valued, but that will change. It's not as dire as what you think. And keep constantly relearning. You have to be a lifelong learner and continually hone and sharpen and expand your skill and knowledge set to respond to the change that is going to occur all the time. Sarah, I believe we're in overtime.
Yeah, I think that'll wrap it up. Thank you all for your presentations, and thanks everyone for joining us. And I'm sure if there's any additional questions that they have, you guys have all provided your contact information, so you can reach out to them in particular. But thanks everyone. Have a great day.
Okay.
Thank
Thank you,
you.
everyone. I enjoyed talking to you. Happy World Environmental Health Day.